Hello, my name is Claire and I'm going to be talking about motivational interviewing. Motivational interviewing is a method of counselling aimed at enhancing a person's own motivation to change. Studies have shown this method to be more effective than cognitive behavioural therapies when treating adults and adolescents with drug and alcohol problems. There has also been some evidence that motivational interviewing can help with quitting smoking, reducing risky sexual behaviours, and improving compliance to medication and treatment protocols. There is a theory called the trans-theoretical model, or the stages of change, which is made up of 5 stages. The first stage is called the pre-contemplation stage. Here, it is the practitioner's job to increase doubt and raise awareness of the risks of the bad behaviour. The second stage is contemplation. This is when the person is getting ready to change. Now it is up to the practitioner to help the person tip the balance on the pros and cons. They must also increase the patient's confidence in their ability to make the changes. The third stage, preparation. Action ready involves giving support and making clear goals and taking steps towards a realistic plan for change. The fourth stage is the maintenance stage, or sticking to it. Here it is the practitioner's task to help the person recognise signs and prevent relapse. The fifth and final stage is relapse or learning. This is where the practitioner must positively support the person to reconnect with the contemplation stage to try again without becoming stuck or feeling like a failure. Motivational interviewing attempts to normalise relapse and have it understood as a part of the learning journey towards change. The spirit of motivational interviewing involves the principles that the autonomy of the patient is respected and that the therapist must support the person to utilise their own intrinsic motivations. Rather than some counselling techniques which involve the counsellor as the teacher or the expert telling the patient what they need to do. The application of motivational interviewing can be broken into 2 phases. The first is building motivation to change using the acronym OARS, and the second is strengthening motivation to change. The OARS involve 4 basic principles. The first is to ask open-ended questions. This way, the patient does most of the talking and the counsellor can learn about the patient's values and goals. The second skill is to make affirmations. Making positive statements or comments towards the person builds rapport with that person, who will then feel more valued and understood. The third skill is to communicate using reflections. This involves rephrasing something the person has said to capture the exact meaning, therefore validating and supporting their progress towards change. To use summarising is the 4th skill required. This skill involves checking in with the patient to ensure mutual understanding towards the discussion so far. It demonstrates that the counsellor has been listening and gives an opportunity to point out discrepancies in goals and values when engaging in the unwanted behaviour. Motivational interviewing should involve equal listening and talking time. One of the barriers to motivational interviewing is the small amount of time generally allocated to counselling sessions. Milner and Rolnick came up with the acronym RULE to attempt to shorten the time needed for the motivational interviewing process. R is to resist the writing reflex. Practitioners generally discuss with patients the reasons their behaviour is detrimental to their health. This may simply spark the ambivalence in the patient and have them stating their argument against change, rather than exploring their inner motivations and desires towards change. Counsellors must resist the reflex to tell the patients what they should be doing. U is for understanding the person's own reasons for wanting change. Having an idea about the person's values and goals by listening rather than talking, the counsellor can support these particular values and goals when discussing discrepancies in the client's reasons for ambivalence. L is for listening with empathy. The skill of listening and empathizing with a person is needed to try to understand what will motivate that person towards change. The counsellor needs to listen without judgment and attempt to understand the person's perspective. Curiosity towards the person's experiences, feeling and values, without condoning maladaptive behaviour, invites the person to feel comfortable and genuinely understood when discussing their thoughts and feelings. E is for empowering the patient, which is a skill that enables the patient to feel confident in their ability to change. Exploring the person's knowledge and ideas about what has worked in the past empowers the person to believe they might possess the skills they need for change in the future. Barriers towards motivational interviewing include time issues and education required to master the skills to use the method successfully. Patients often have a desire to want a quick fix to their problem, but motivational interviewing takes time and personal development work. Perhaps utilising and becoming more aware of the principles of motivation in motivational interviewing will help in general practice for a certain number of patients. Thank you.